have Q&A sessions or between the presentations. To hear interpretation on your computer, you need to go to the bottom of your screen, of your Zoom screen, and press the globe button. This is interpretation right to the right from share screen. These technical guidelines will be available in the chat box to make it convenient for you. You will have the two options of languages. This is English and Russian. Please choose the language that it will be most comfortable for you to follow the event. If you only want to hear interpretation without the original, you can mute the original. Also, when you change speakers and languages, you do not need to change anything. The interpreters are going to manage that. So you only need to choose the language channel that is convenient for you, and you just stay there till the end of our online meeting. For you to have access to simultaneous interpretation function on your phone, if you connect from the phone, on the panel in the bottom of the screen on the right, you can press the three dots button, then you choose Russian or English, and then don't forget to mute the original so that you did not hear the original, the speaker, and so that you could only hear the interpreter, and then you press ready. You can also zoom into the presentation. You can use your screen settings near the on the top. You can check the view settings, and there you can zoom in or out. And then you can follow the presentation with your mouse device. And detailed guidelines will be available in the Zoom chat in Russian and in English. So, colleagues, good morning, good afternoon to those who have just connected. Leslie, maybe we can start. I just wanted to check with you if we should start now. Which countries are with us? Colleagues, could you please write in the chat indicating the countries that you represent? Unfortunately, the chat function is disabled, so we cannot write anything in the chat. And I see the message, but this is the technical message from our technical staff. Then, colleagues, while we try to sort out the chat issue, let us start, I guess, not to take it longer today, if you don't mind. And then in the course of that, you can indicate which countries you represent for us to have a better idea then. Colleagues, let me once again express gratitude to you. Thank you for having joined our online session today. And today we speak about the algorithm of data collection for the 4 WHO Europe indicators. And I would like to now pass the floor to start this meeting and to pass the floor for the welcome address to the Executive Director of TBEC, Yulia Kalencha. Dear colleagues, I'm happy to welcome you at our today's meeting on behalf of European Coalition for TB. And as you know, the political declaration that was adopted at the high-level meeting, UN high-level meeting, WHO strategy to eradicate TB, and a lot of other strategic documents, they also call on us to focus primarily on ensuring active involvement of civil society and communities communities in all aspects of TB response. And in order to have a better understanding of to what extent CSO's involvement and involvement of communities in your country matters, is significant, it is important to periodically measure and assess the degree of involvement of civil society into the TB response. And thus, European WHO office developed the action plan to respond to TB in European region for 2020-2023 until 2030, and that also includes the monitoring plan to assess the progress, and 4 new indicators were suggested to measure the engagement and the impact of communities and CSOs on the TB response processes, and also to enhance CSOs and communities in implementation of activities based on the communities. And that is why systemic data collection by WHO and the communities and CSOs, that could be a key factor to increase efficiency of TB response that is community-led and implemented by CSOs for further timely making of the respective management decisions at the country level. And here, together with WHO, and we are grateful to Georgi Kuchukvidze and WHO Global Program. So TBEC with WHO have developed the algorithm that will help us to get involved into data collection for the 4 indicators on engagement of communities and CSOs, and thus to support TB response programs within WHO reporting, to make it possible for WHO and the countries to track at their level the progress in achievement of global targets and objectives regarding meaningful involvement, engagement of communities and CSOs. The algorithm will be presented in more detail by our respected speakers, so you can significantly and meaningfully involve into data collection, include that into your projects, and follow the progress at the country level. I'm sure that today all the participants will gain the new knowledge and will be able to apply those further on in implementing the activities to collect and analyze data and information in your countries. I'm also very grateful to our speakers today. Thank you for your time that you have allocated to share your knowledge with the participants. And to the participants, I'm so grateful for your readiness to accept the knowledge, to share the experience. And I believe that when we bring together efforts in data collection and in TB response, we will be able to change the situation with TB for the better. And today we will be happy to actively engage with you and further on to support your advocacy initiative. So you are always welcome. We are ready to help you. Thank you so much. Thank you, Yulia. Thank you for this welcome address and for this positive attitude. And we move on. I pass the floor for welcome address to Sayahat Hasanova, technical expert of the infectious disease department of WHO Europe. Thank you, Lesia. Thank you, Yulia. Good morning, good afternoon, dear colleagues, dear friends. I am so happy to see you here today at this training. And let me, on behalf of WHO Europe, welcome you all. And I would like to say that for us, for WHO, one of priority areas is meaningful involvement, engagement of civil society and people affected by TB in TB eradication at all levels, global, regional, and national levels, because we know that the objectives, targets that we set, they are very ambitious. To eradicate TB by 2030, well, maybe we won't be able to do that fully, but we are investing all efforts in order to achieve progress with these ambitious goals and objectives. We need to act together. We need to join our efforts, all sectors, all partners, all stakeholders at all levels, including civil society and the communities, people affected by TB. So what's required there? it is necessary that you, civil society, and the communities affected by TB, that they knew their roles and their objectives, so that they could enhance their knowledge for effective and efficient implementation of these objectives. I'm glad that we have this initiative that was suggested by the European TB European Coalition to enhance the capacity of civil society and communities affected by TB. Months ago in Almaty, we held a very helpful training to enhance the capacity of civil society and affected communities in monitoring and review of national TB programs. And I am happy that we continue with this initiative. And today we have this important training to enhance the capacity and to involve the civil society in data collection for monitoring and assessment indicators for the new action plan for WHO European region. You know that data collection is a component of monitoring and evaluation. And the data that we collect for monitoring, they will help us track efficiency of the programs or inefficiency, lack of efficiency of those programs to eradicate TB. And thus they help us to track the progress on the path towards eradication of TB at all levels, global, regional, and national levels. And they also will further help us in strategic planning, and the results, findings of monitoring and evaluation will support strategic planning, but also objective settings and defining the obligations, commitments for further eradication of TB. So by participating in the data collection process, you also make your contribution for strategic planning to determine new priorities and new commitments. Speaking about data collection, I would like to attract your attention to the quality of data collection, because quality data collection makes it possible to see the actual situation, to see the actual picture, and to see the gaps, niches, issues, challenges. And that is something that is helpful for strategic planning of the next steps. Unfortunately, data collection and quality of data collection in our region and at the global level leaves much to be desired, so to say. So we need to improve the data quality, and with your help, we expect that data collection for meaningful involvement of CSOs and communities will reach new quality level and will show actual engagement of CSOs and communities in the work to respond to TB. Based on global report data, even though currently the process of CSO involvement is being activated everywhere, including our region, it is not yet well reflected in the reports. So we hope that today's training and also the algorithm, as mentioned by the colleagues, by Julia, the algorithm that was developed together by TB, EC, and WHO, that it will enhance your knowledge and will improve data collection, quality data collection. And I'm sure that with our joint efforts, we will achieve progress in eradication of TB, and I wish you a successful training. And let's stay in touch. And I wish you every success. And let's work in a joint and coordinated way. Thank you, Seyhan, for your wishes and for what you have said. We are sure and we hope definitely that today's event will contribute into a better understanding of how we should respond, act, and how to improve the quality of data collection. Thank you again. And now, colleagues, I pass the floor to Georgi Kuchukidze, representative of WHO Europe, and he will speak about the role of CSOs and affected communities in the process of monitoring of meaningful engagement of CSOs and communities within the action plan for TB action plan for the WHO European region for 2023 through 2030. I pass the floor to you. And please, colleagues, if you have not yet muted yourselves, please do that. Georgi, you're welcome. Thank you so much, Lesya, and thank you for your invitation for this meeting. I have a very short presentation that I would like to share with you. My presentation is going to be in English.
Предпочитают слушать на русском языке, переключитесь на русский канал. Я знаю, что есть у нас перевод.
And I ask those people who speak Russian, who are Russian speakers, to use the interpretation function. Yes, we have the interpretation function, but we ask you to speak closer to the microphone. We don't hear you very well. Can you make it possible for me to present now? Great.
Okay, so I think Lesya and Yulia, they already mentioned, as well as Sayohat, they already mentioned the MNE framework of the TB action plan for WHO European region, which was endorsed by the member states back in September this year. And this new action plan covers 2023-2030 years. And it has ambitious targets and milestones. We have milestones which we believe that countries should achieve by 2025. And these are 75% reduction in TB deaths, 50% reduction in TB incidence rate, and 80% treatment success rate among MDR-TB patients. And then we have regional targets, which should be achieved by 2030. These are 90% reduction in TB deaths, 80% reduction in TB incidence rate, and 85% treatment success rate among MDR-TB patients. So these are very high-level indicators, but there are also some output and outcome, so lower-level indicators that programs should achieve in order to meet these high-level impact indicators and meet these targets. That is why we developed the monitoring and evaluation framework, which is the integral part of the TB action plan. And it was developed during the last 2 years with the involvement of experts. And we established a task force, which was working on producing and developing the list of indicators. And we were privileged also to have representatives of the civil society organizations. The TB Europe Coalition was part of this task force. And we proposed and developed the list of indicators that later went to the public consultation to the member states, which happened back in February, March 2020. And we ended up having the MNE framework, which includes 30 indicators that are linked to key areas of intervention under 3 pillars of the action plan. There are global core 10 indicators among these 30 indicators, as well as additional 4 priority indicators that are priority for the European region. And also the 4 civil society engagements related indicators. And later my colleagues will talk in more detail about these 4 indicators and the algorithm that was mentioned by Lesya and Yulia. But in short, what's the structure of the MNE framework? It includes the baseline value for each and every indicator, as well as the milestone and target, frequency of assessment, the data source, the layers of analysis. Under the layers of analysis, we mean different group of countries. As you may know, we have the high TB priority countries in the region, and some of the indicators are relevant only for this group of countries, as well as there are indicators that are relevant for the whole region, and maybe the indicators that are relevant only for low burden TB disease countries. And then the very detailed definition of the indicator as well, which is included in the MNE framework. These are the list of indicators, and I want to draw your attention to the first two indicators, which is under the area of intervention called People at the Center, and which is about the meaningful engagement of the civil society in civil society organizations in the provision of some of the services and support to TB patients. And these two indicators are about adopting the standards and operational procedures for the involvement of CSOs, as well as adoption of the procedures of subcontracting mechanism of organizations in providing this support to the countries. And these are two indicators and about the standards and operational procedures will be discussed later during the meeting by my colleagues. We also have other indicators, and I will be talking about those indicators that are related to TB diagnosis as well as TB treatment and care. But also there are two more indicators under another pillar and another area, which are proportion of people with TB found through active case finding activities implemented through civil society organizations, and proportion of people with TB who started TB treatment and who received any form of treatment adherence support from civil society organizations. So these are additional two indicators that are trying to measure the meaningful engagement of the civil society organizations. So these are, in summary, the new indicators to monitor the progress. And under these new indicators, as I mentioned, 4 indicators are related to the civil society organizations. I'm currently attending a meeting with the representatives from different national TB programs who are reporting to WHO. So these are epidemiologists working in the national TB programs. And I also presented this MNE framework to them. And they kindly asked us to support in collecting these indicators, these 4 indicators that are related to civil society organizations and the meaningful engagement of CSOs in TB response. So I'm really happy to hear that today we will be discussing the in more detail the algorithm that is proposed by our colleagues from TB Europe Coalition on how this data should be collected at the country level. And then the data collected can be reported directly to WHO through Global TB database. But the people at the NTP level, at the National TB Program level, who are reporting to WHO really need the support from civil society to collect this the information about these 4 indicators. The progress on reaching the targets will be reported in our TB surveillance and monitoring in Europe report, which is published every year in March during the World TB Day. And it provides the summary on the progress towards reaching those targets and milestones that are described and included in the MNE framework. So this is in short. I'm looking forward to hearing more discussions around the data collection for these 4 indicators. And I know that the focus of this meeting is on those 4 indicators that are included in the MNE framework. Thank you.
Спасибо большое, Георгий, за то, что дали нам такую вводную, да, за то, что,
Thank you very much, Georgi, that you found time for us to meet today and tell our participants about these about the relevance and importance of data collection and about the importance of these indicators. Now I give the floor to Tatiana Terleeva, head of the Department of TB Response of the Center for Public Health of the Ministry of Health of Ukraine. She will tell us about the vision of NPT on how the cooperation on data collection is implemented in the country. Yana, hello, I am glad to greet you. Unfortunately, now you know that Ukraine has very difficult times because our critical infrastructure is destroyed, and unfortunately, due to the interruptions in the electric power supply, I cannot switch on my camera. But we are all together with you and hope that you hear me and hope that we will not have a lot of technical interruptions. Yana, we hear you well. Thank you. I'm glad to greet all the participants on behalf of the National TB Program of Ukraine. And what we discussed today, in continuation of what was said by other speakers, we should focus on the following. Today, we are on the threshold of new changes in the area of TB response, and we, on the one hand, can see these changes, support these changes, and we can become the part of these changes. And TB Europe Coalition is the driver of these changes. So, and for the countries which are present here today, it is very important. And I am glad that Ukraine is also part of these changes, because Ukraine is striving to become a leader and role model in these changes. But we are ready and happy to learn from other countries' experience. And in the process of discussion, it will be also very important for us to see how these algorithms work, how how realistic they are, and how they will be implementable for the countries that participate in us, because we are going to implement the approach which will be useful and helpful to all countries of the region. Of course, now we see that great conditions have been created by the World Health Organizations, and the indicators are developed, which are also very important. And the recognition of CSO role is also important. And please agree that we need some instruments, some tools to measure the achievements on the level of the countries and compare our progress in the countries. And we would like to work in cooperation so that countries would be able to collect this data, and later when these data are reported to the WHO, this data should be comparable and they should be used to promote the best practices, best programs. And we are sure that many countries will show good results, very good results on achievement, on implementation of these indicators. And so we are talking that today in Ukraine, we have very good cooperation with the representatives of the civil society, and they are included in practically all our national processes related to TB response. And an important role is to be as open as possible and to understand that we are partners in the first place. And now we rely very much on the impact from the civil society. And now we have a number of coordination platforms, and the Center for Public Health, which I represent, is the key coordinator. Also, we have a National Council on TB and HIV response, and it is also another coordination platform which involves and engages representatives of the TB communities. And every year we conduct a mapping of all civil society organizations to understand how many organizations are working in which areas. And so we know which organizations can provide data by the indicators that we're talking about. It is very important for us to understand which data should be collected. And we should understand that there are many countries which use global fund grants or USAID grants. Now many countries are now switching to the state budget fund, and there are individual initiatives funded from the local budgets or from some other not so well-known sources. And we need to understand who works in this area of TB response. Second, who is collecting this data? It is also important. We made a decision that the national TB program and the Center for Public Health will collect this data and then present this data on the working platforms of the National Council on TB and HIV response and on its working platforms. It can be a programmatic committee and committee on the regional policy in order to further distribute this data, because our goal is to learn how to work with this data, because this data should work for us. They will help us to understand the most important information to make managerial administrative decisions, to see the changes, not only in our country, but in all other countries as well. That is why it is also a very important aspect. And we also need to have systems to collect this data and to verify this data. It is also an important part of this process. For more than 10 years, we have been using electronic tools which were being implemented with the support from the WHO. Now we're switching to another system because the old system exhausted its resources and capabilities, but we have a special department where we can see how many people are receiving treatment and supporting treatment, and we will implement this potential, this capacity in the new system. It is a unified system for Ukraine on TB and HIV, because both infections impact each other, and for us, it is a possibility to improve coordination between two services. Also, our governmental organizations that work in this area have their own electronic system, and we are now thinking how to integrate the systems developed by civil society with the national system so that we established a uniform mechanism of data collection. And we know that other countries have their own systems, different approaches, but we hope that we will use electronic data collection mechanisms more and more, reduce the data collection on paper. But we have the plans to initiate, to start this process, and understanding of the importance of this data collection will stimulate us and will stimulate us to update the systems which we already have. And many our countries in the region are supported by the granting system, and technically everything is ready to start working in this area. So we would like now to present our steps, our approaches, and together with our Secretariat of the National Council, we would like to get a feedback from you. And most important is not only to report this data to the WHO, but to see that we are managing to do it, and to see that more and more people receive services, to see that more patients are cured, more patients recover or receive support, and have higher chances to be cured. And thank you very much. And I would like to thank the WHO and TB Europe Coalition, and to our partner countries that participated in all our discussions. I would like to specify, we had several discussions with the participation of international partners, WHO and the Secretariat of the National Program, and representatives of our organizations, Alliance for Public Health and Network and TB People Ukraine, and other NGOs that work in this area directly. And in our country, it is possible to present this data, how it is possible in other countries. We will learn in the end, by the end of this workshop. So peace to everybody, and please be safe. Yana, thank you very much that despite all these hard conditions in which we are living now, some people do not have internet or do not have communication. Thank you very much that you found the possibility to join us in this webinar. And now I give the floor to Irina Roeva, who will tell you about the algorithm of data collection by 4 indicators suggested by the WHO. Ira will tell you about the goal and mechanism of this data collection, about the approaches, and will provide more detailed information about each of 4 indicators. Hello, dear colleagues. So I am talking after Yana Sergeyevna, and I would like also to thank everybody, all participants who took part in the discussion of this very important strategic document on all levels, both representatives of a non-governmental sector and representatives of the governmental structures, representatives of the monitoring and evaluation department, national department, and many others, including the civil society organizations, as Yana Sergeyevna said before. At all stages, a lot of work has been done, and our goal was to develop a simple and understandable mechanism which would be understandable on the level of each country and which would be used very simply and which will not require additional funds. I would like to switch the slides so that we will be able to see the discussion. As you understand, the key goal of this algorithm is strengthening of community mobilization, civil society mobilization for the implementation of the mechanism for systemic data collection. And different speakers today were talking and were mentioning the importance of the implementation of the mechanism for systemic data collection, which is a key factor to increase the efficiency of TB control activities for the timely decision-making on the country level. And these decisions, national decisions, will create for us the entry point, the starting point to discuss this or that indicator.
So next slide, please, colleagues. Okay, so now about relevance. The relevance of this algorithm is that it is possible to track at the country level the progress towards reaching the global targets of meaningful CSO engagement. There are several initiatives like that, and I will not try and focus on all of them, but ensuring sustainability of the programs has for years been the key initiative, and especially this is relevant for the programs about support to internal sources, to domestic sources. Then integrating approaches in non-medical service delivery in line with the standardized package of community-based support services. That's also important. Standardized package of services, this is what you will often see in the document, because we will need to have a clear understanding of which services we're speaking about when we speak about certain indicators and data collection for each indicator. Next important factor is implementation of comprehensive people-focused TB control models and systemic approach in medical, social, and psychological care provision. And of course, implementation of quality interventions within the framework of support services to improve evidence-based TB prevention and treatment outcomes aligned with the international standards. Next slide, please. So as you can see, the algorithm was developed as certain guidelines. And today, this is how we are going to follow the algorithm as the guidelines. We will be in the position to define each indicator and the description of it, the criteria and the evaluation scale. This is for indicators 1 and 2, and you will see that our approaches to the first two indicators, they are the same. Actually, same for indicators 3 and 4, and I will now explain a little bit why. So there we have not evaluation criteria, but estimation of the indicator. And for each indicator, we suggest a template of the reporting form. This is the data collection form template that will further serve as the reporting form. To make sure that this document is sufficiently straightforward, understandable and useful, at each phase, we held consultations with MOE experts and with the organizations that directly in the field implement programs for, CSOs that in the field implement those programs and that to a certain extent use various reporting forms. Thus, we move to the next slide. And the next slide, this is about those 4 indicators based on which this algorithm was developed. And now their specificity. I will try and cover each indicator further on. And of course, we will analyze each of them separately. But what it is important to emphasize now. The indicators 1 and 2 show impact of communities in line with state policies and procedures.
Нам влияние сообществ, исходя из количества людей, охваченных.
The third indicator, this is based on the number of people who are covered with specific services. That's the difference in the approaches to indicators 1 and 2 and 3 and 4. And now let's proceed with the next slide. So we approach the procedural part.
И периодичность отчетности, то есть сроки, в
And
которых...
here it is important to speak about reporting, the deadlines within which we will need to provide the...
Далее мы будем везде использовать сокращение NTP
to
ключевым распределителем данных по 4 индикаторам.
So reduction of NTP, this is the indicator, and NTP ensures the collection and generalization of all the data at the country level, and on the annual basis provides WHO with the information on completion of the indicator. I will swap the role and frequency of reporting in this table because we speak about that WHO will annually receive aggregated information from NTP. Let me proceed with reporting, and we will further emphasize frequency.
То есть по индикаторам номер 1 и номер 2
for this information to be properly recorded. Speaking about policies of the state, NTP receives data annually at the end of the year. This will be the annual report that will be submitted before January 31. For indicators 3 and 4, there will be 2 reports. One for first half year as of the 1st of July, and the annual report as of the 31st of December. So based on results, so the semi-year, half-year report will be intermediary. So after 1 year, based on data for the previous half years, the aggregated NTP information for WHO will be generated. For indicators 1 and 2, NTP collects data based on analysis of the regulatory framework in the country and based on assessment of policy implementation at country level. This is standards, protocol strategies, and so on and so forth. And then in the documents, we will speak not only about regulatory policies, but also about the other possible forms of documents that at various phases will indicate implementation of the procedures. For indicators number 3 and 4, NTP holds assessment based on data obtained from healthcare facilities. And NTP verifies data obtained from medical facilities to make sure that the same individual with TB is not recorded twice or more times in the aggregated data if one TB person, TB patient receives services from several CSOs within one reporting period. That's important. That's why we wanted to emphasize that. Speaking about CSOs representatives, organizations collect data using any of the available systems to rate the rating on implementation of programmatic objectives and introducing the data into reporting documentations. In countries, it may be named differently. In Ukraine, it is the system to track rating on implementation of project objectives. So this is how we refer to it. And since various organizations use various data collection systems, any of the forms available can be used in the process of implementing the algorithm. And now let's proceed with the next slide. And now we proceed. I'm sorry, maybe here we need to take a pause before we proceed with indicator 1, and maybe participants already have questions. Yes, of course. Colleagues, maybe you have some questions about the goals and the scheme of the algorithm, its relevance and approach to data collection. This is something that Irina has just presented. I see no hands raised. Maybe we will have questions about the indicators. Yes, of course, you will still have the opportunity to ask the questions after the presentation, but we wanted to take a pause here. And not only because we will stay in touch for further processes of implementation and coordination. Yes, thank you. And then we continue. The floor is yours. Okay, let's proceed with indicator number 1. And this is the following. Number of member states with adopted standards and operational procedures for civil society organizations in the provision of psychosocial support services to ensure treatment adherence for people with TB. Why do we need this indicator? Analysis of implementation of indicator number 1 will help us to dynamically track the involvement and the impact of CSO on the general situation, overall TB situation in the country. And it is proposed to use 0 to 1 scale for evaluation of progress of this indicator to evaluate the degree of progress for indicator and further on changes over time in each country. Next slide. And to ensure the data collection and analysis for this indicator, we suggest answering several questions that will be criteria to assess the implementation, and the answers will further be used in evaluating the indicator at the moment of report preparation. Here we suggest data collection based on 2 mechanisms. And the first one is a discussion of answers at the general stakeholders meeting and agreeing upon them, or any other possible forum to hold these meetings. This may be working meetings, seminars, and so on. And also solicitations of additional information necessary to the public authorities to answer the questions through inquiries. Or it's possible to combine these 2 approaches, to hold stakeholder meetings and also to submit inquiries. Next slide, please. And now we process with the progress evaluation scale. 0 score, no activity has been initiated. Here we can see that in the regulatory documents or policies of the state, there are no provisions or recommendations on that TB social assistance for population must or can be provided involving CSOs based on standards and SOPs for provision of these services. Actually, it is quite obvious. 0, it means that there are no such documents in the country. Next slide. Then score 1, we refer to it as intermediary score, but we believe that it is important to have it because it reflects the intentions of the country, because not always the documents already support the process of coordinating certain documents in the country. So score 1, it means that the activity has been planned. Speaking about the criteria, we see that in the regulatory documents that are relevant for the country that indicate that TB assistance can be provided involving engaging CSO based on the standard and operational procedures of such services. Delivery has been initiated, discussed, or approved. I mean, it's possible that there are no documents as such yet, but when the report is submitted, there are minutes of meeting sessions that support the intention of the country to start developing the respective standards and documents. Next slide. Score 2. It shows that standards and operational procedures are developed and discussed. So the regulations, public policies, and so on and so forth that will regulate the procedure of CSO engagement in psychological support provision and endorse standards, operational procedures of providing such services have been initiated. These documents or activities have been initiated, discussed, or approved. Here it is more or less clear, and we are ready to proceed with the next slide. Score 3. The standard operational procedures have been endorsed. We are sure that each country will have documents in place and that as of now can be scored at 3. Now, speaking about the criteria of this evaluation, it's obvious that we understand that existing regulations issued by public authorities that regulate the procedure of CSO engagement for provision of TB-related social support, and these procedures, standards, operational procedures are endorsed. Next slide. The next slide, this is score 4. This is the highest. And it shows to us that the standards and operational procedures have been implemented. Now, moving to criteria of this score, here we see that the state system of reporting, monitoring, and evaluation of TB social care provision to population include collection and analysis of indicators measuring delivery of psychosocial support services by CSOs to ensure TB treatment adherence. And here, this is it for indicator 1 assessment score. And actually, the review of indicator 1 is also completed here. Since we will consider the reporting form after we have considered the both indicators 1 and 2, because the approaches are more or less the same, I suggest that you ask questions now. If you have any questions about this indicator, indicator 1, any clarifications, questions, let's discuss them now. Thank you, Ira. And colleagues, participants, if you have questions, come up with them. You can voice them or you can write them in Q&A section. You're welcome.
Либо все понятно, либо ничего не
Either everything is very clear or, oh, we have a hand raised. Yes, you're welcome. Nona Turuzbekova, you're welcome. Hello, and thank you for your presentation. Maybe I did not get it right, but I don't quite see how you're going to link what you have described, the evaluation 1, 2, 3, 4, with the indicator. I mean, the indicator, as far as I understand, is the number of member states that have adopted the standards. But this score evaluation, this is done at the country level. So then only those countries that have the score of 4, they are included into the pool of countries with standards adopted. Could you comment on that, please? Well, this is directly linked, this indicator with that. So score of 4 is, of course, the score that the country aspires to, and all the intermediary phases, as you can see, they impact the final result. Speaking about the indicator, I believe that we need to focus on the wording of the indicator. I believe that it would be good if Yulia Kalinchak could comment on that so that I didn't step back from the document. Yulia, can you comment on the indicator? And then I will continue speaking about how it's going to be linked with the general NTP program. Can you hear me? Yes, we can hear you. Thank you, Nona, for that question. And the idea was this, at least this is how we agreed with the WHO monitoring and evaluation team. So you are right saying that the answer is the result is the number of countries. But when the country includes the data into the data collection form, they are supposed to write to indicate if they have the standards in place or not. And in some way, this evaluation needs to correlate, because one country may believe that, for example, that the adopted document, many countries now have those adopted standards, and they believe that that's already the situation where it is in place in the country, or the standards have been adopted in the country, but they are not implemented further. Or maybe the standards, they have been adapted to the public contract. So here we discussed it with WHO that there will be comments to the response to the feedback from every country, where there will be this hierarchy respected, so that we could track the progress of every country. If this year the country says that the standards are just adopted but not yet endorsed with a regulatory document, next year, and the country anyway indicates that when they answer the question, they say that yes, we have the standard in place in the country, and then we need to track that. What does it mean? Yes, we have it or not.
Although the country can adapt these standards on the country level, but maybe is not endorsed on the country level. There is no regulatory document which would allow CSO to implement these standards in practice. That is why, to be brief, there are standards. Indicator will include the number of countries. So countries write that they develop standards or not, and below there will be a comment where the country will specify the score 1 to 4, which will reflect the level of the situation in the country, so that WHO would be able to monitor the progress. So, and if you have any comments to it, please tell us, because now this document is presented to you to discuss how it is or will be more convenient to you. I see that Sayohat want to comment. So we have one more question. So if you want to clarify something, please tell us, and then I and Sayohat will provide our comments. Maybe I did not understand. Hypothetically, if a country received score 4 and another country received the score 2. So when we talk about the number of countries with the standards, what are we writing there? 1 or 1.5 as a score? Look, we will not have 1.5 or 2. The indicator reads the number of countries. So these scores 1, 2, 3, or 4 will be related to whether the program or standards are implemented or not. So I'm talking about 2 countries, hypothetical countries. Okay, for example, these 2 countries write that they implemented the standards, but they will have implementation of the standards on different stages. 2 countries specify that they have standards, but they are on different stages of implementation. For example, one country has already implemented these standards in practice, and another country is just adapting or has just adapted it to country realities. And both countries wrote that they have such standards. But in order for WHO to evaluate the progress in future, the countries will submit their data, what they have now, at the moment. For instance, one country has just adapted the standards and stopped. But for us, it is important that this document would work. And for us, it is important that the civil society organizations would be able to use this document as a working document. And if one country stopped on adaptation, the idea is that this country should use these standards. And for the convenience of the countries, member states, and for civil society organizations, so that there was no question why the country writes that it has standards, but in practice it does not have them. We see it often. That's why we developed such a gradation, such score system to monitor the progress and implement this approach in practice. Is it clear? Yulia, I would like also to add, if we look, if for instance, a country specifies 0, there is no activity, it is not yet started, it is also an indicator to understand why these activities are not implemented, why these documents are not yet developed. By filling out this form, you already specify the activities and your interests so that services are provided and so on. But if you cannot evaluate your activity higher than 0, and if you do not have processes in the country which could confirm that this score is higher than 0, for NTP, it is also a ground to review the situation on the national level and so on. So we are striving to improve these processes. Or, for example, this indicator is also important for WHO, and Sayohat maybe add something. So, for instance, WHO will understand that more technical support is needed for the country to implement these standards. If the score is 0, this is not bad. It means that the work should be intensified, that civil society organizations should be engaged more, because we need to understand that everybody is interested to move this process further. And that's why we need to engage the civil society in these processes. If you have the standards and if your first score is 0, This means that the country is not undertaking the responsibilities to improve engagement of civil society within the donor funding. So that's why this indicator is important. And Sahai, maybe you would like to add something. Thank you very much. The discussion is very interesting, and thank you, Nona, that you raised this question. I was not involved in this process before, but I also have such questions. And at the same time, I have a brainstorming in my head to understand these four gradations, these four pillars. When we talk about data collection, about statistics, we understand that there are qualitative and quantitative data on the global level. And we understand the level at which these data are collected. And on the global level, it is important to evaluate, to make an estimate of these processes. So that's why on the global level, quantitative and qualitative data are collected to understand which processes are launched and or adapted. So if the country adapted some standards, well, this means possibly that the country is going to introduce and implement these standards. Second indicator is developed for the quantitative analysis to understand how many countries adapted it and how many countries are implementing it. But we still need to think what is understood by the implementation. And in this case, we will have many more other indicators. That's why on the global level, a decision was made that for now, this one indicator is enough. On the regional level, we analyze the reporting, and we are also going to implement qualitative analysis. And this gradation, this score system will help us in this. If we talk about qualitative data collection in the countries, and if these procedures exist, there will be comments, and these comments will be important for us, for the regional office. It will be easier for us to conduct a qualitative analysis on the basis of this quantitative indicator. And this analysis is necessary. And third, on the country level, these indicators are collected not just for reporting to WHO. And the WHO, according to its mandate on the country and regional and global level, should provide support to the countries to ensure that we are moving towards the goal. So I absolutely agree with Yulia that it is important for the country to understand at which stage it is now, because every year when the country provides its reports, so it is important for the country to specify that we adopted the protocol and now we are on this or that level. And every year we analyze these reports. We often talk about a multi-sectoral mechanism for accountability on the high level. And these indicators will show us the progress achieved in the countries, the progress in the implementation of this or that indicator. And for you, it will be also helpful to look at these indicators, not as the data which you report to WHO. These data are important not only for WHO, but for the countries, for you. Serhat, thank you very much. I see another question in the chat, and it is related to the topic that we are discussing. I don't see who asked this question. Maybe the score 4 should reflect the result of implementation. For instance, a certain number of people were treated, which were enrolled in care. You are correct. The idea with these indicators is very simple. Each indicator is related to the next indicator. The first indicator standards is the basic indicator. Second indicator, which we are going to discuss now, is implementation of the social contracts. And it reflects, hello, thank you very much. So this second indicator answers the question about implementation, what Sayohat was talking. So we should be able to view these two indicators separately. And second indicator reflects the level of implementation. When we have standards, next step is implementation, and the standards are the basis for the social contracting or subcontracting. And then we have two more indicators which answer the question where the social subcontracting is being implemented, because the next indicator is about social support, social follow-up, and about the active case funding of people with TB. So first indicator, we look whether the policies are implemented on the country level. This is a social assignment, social order. Second indicator is implementation of these standards in practice through the mechanism of social subcontracting or through any funding mechanisms existing in your country. And the next two indicators help us to evaluate the efficiency of implementation of the mechanism of state funding. These two indicators reflect active case funding, where CSOs and communities can show the highest efficiency. And the next indicator is the social follow-up, social support, and provision of psychosocial support through the activities implemented by the CSOs. That is why each next indicator is confirming the implementation of the previous indicator. So I think that your question is absolutely correct. And later on, we will talk about the consequences of what is meant by these indicators. I hope I answered the question. And so we can go further if there are no more questions. There are no more questions, no more raised hands. So, and yes, you answered the question to the participants. Thank you very much for this discussion, for the questions and answers. The questions were absolutely correct. Thank you, Sayohat. Thank you, Yulia. Ira, I give the floor to you. So now we move to the next indicator, to the next slide, indicator number 2. And it reads like this. And before we switch to this indicator, I would like to ask organizers if we are recording it. So we are recording it, yes? Is it correctly presented? So you can make conclusions on the basis of these discussions, or maybe we need to organize additional meeting to continue discussions. Indicator number 2 reads like this: number of member states with adopted procedures of subcontracting mechanisms under the state funds or other relevant funding mechanisms for CSO in the provision of psychosocial support and active case funding services for people with TB. So here we are talking about a comprehensive approach to allow the entire cycle of necessary services through the involvement of CSO and payment for their services to achieve the results. And the result here to which we are striving is recovery of people and their return to the active social life. Next slide, please. And when we talk about the funding for the state budget funds, we understand that allocation and use of the budget funds implies that there are a legislative framework on the national level enabling and regulating such relations and establishing the procedures. Yeah, we understand here that it is aimed at the procedures that are related to the planning, financing, contracting or subcontracting, reporting and control. These may be both unified documents for various areas and fields of work, or specific documents, separate documents, and at the same time, the availability of policies and regulatory documents is not a guarantee that they are implemented at the national or local levels. We are having the experience in Ukraine. Why we comment it like this? In many cases, it depends on the level of economic development of the country. At the same time, you will see that using the number 2 indicator, we will be able to analyze and estimate impact of CSO on the national situation with TB. And please, next slide. Also, we suggest the same approach, the scoring system from 0 to 4, and the same mechanism of data collection, discussion and agreement, and the submission of the applications to the government bodies. Some aspects are duplicated here and in the indicator number 1, and I suggest that we switch to next slide. So if the score is 0, so it is the same as in indicator number 1, activity has not been started. So we understand that there is a lack of provisions or recommendations that TB support to the population should be or can be provided at the state budget funds on the basis of subcontracting mechanisms or other mechanisms of funding. And now we switch to the next slide. We see that score 1 shows that this activity is planned, has been planned. And if we evaluate it, we understand that the draft regulatory documents or policies or other programs are endorsing the intentions. The country understands that these activities should be implemented at the state budget funds. We will not stop here, focus here. The logic is understandable, as well as in indicator 1, we move from one criteria to another. And next score, next slide, please. Next score is 2. It shows that the mechanisms for subcontracting are being developed and discussed, and respectively, we understand that the draft regulatory documents already are being developed, and they describe the processes of their approval, of their discussion, and so on.
And now assessment number 3, the next slide. Score 3. It shows that the mechanisms for subcontracting and funding from the state budget have been endorsed. And now proceeding with the criteria, we understand that the existing regulations issued by public authorities regulate the procedure of CSO engagement in active case finding and provision of TB-related psychological services at the cost of the public budget, and endorse subcontracting other mechanisms for governmental funding of CSOs. Next slide. And the last score here, that is number 4, the high score. And it shows that the mechanisms have been implemented. And the criteria are the following: the state system of reporting, monitoring, and evaluation of TB social care provision to population include collection and analysis of indicators measuring the provision of psychosocial support to people with TB and the active TB case finding services by CSOs at the cost of public budget. Now to summarize, next slide. To summarize these two algorithms, I suggest that we consider data collection forms. Let me mention that the document and the algorithm, as you could see, includes direct links, references to those documents, to templates of the forms that can be used as reporting forms. They are available in the presentation and in the documents, and we suggest a very straightforward format of an Excel table that is in line with what has been mentioned already, and this is the scale, evaluation scale, where you indicate the indicator, the criteria, implementation criteria, where the country is, examples of documents that are either developed or the meeting minutes that confirm, support the process of coordination, and references to those documents as evidence base, which we should collect. For example, at the level of Ukraine, all documents for key meeting sessions, they are stored at the Secretariat of the National Council, which is a coordinating body to combat TB and HIV/AIDS. Implementation assessment according to the criteria and according to the scale that we have discussed already, and comments, of course. Comments may be about, well, if you believe that for certain reasons the evaluation could be higher, the score could be higher, even though there is no confirmation for the discussion and implementation of the document, you can comment on that here. And since we have covered indicators 1 and 2 and we have the same approaches there, I suggest that the organizers now show us a template of that reporting form for indicators 1 and 2. And if you look through the document, you will see that that is easy. And I am sorry to the participants, because the form that we show it to you now, it's only available in Russian, but it is just a template, an example of that, for you to see that it is quite straightforward. Now there is quite a lot of text in it, because here we reflect the cases from Ukraine. The documents in Ukraine that have been developed and implemented, and we indicate score 4, the 4-point score, to indicate to what extent it is true to reality. So you see that it can be filled out quite easily. We suggest you fill that out, and based on NTP discussions, we expect that it's going to be quite straightforward reporting from form. Further on, you see there is indicator 2. This is for 2 indicators. Same for 2. And maybe it is important here to comment on that's a template. And every country at its discretion may revise this template. For example, you may remove something that you don't need there, or you can add to these columns the data that you want to additionally see at your country level. Thank you so much. I believe we can stop sharing here. And if you have any comments for indicator 2 or maybe questions. Yes, we have a question. I see a hand from Oksana. You're welcome. Thank you for your presentation. That's very interesting. Speaking about indicator 2, I have a question there. How would it be possible in the future to come up with the mechanism? Because based on the situation in Moldova, we have a contracting mechanism, but we don't. It's not sustainable. Is it possible, based on this indicator implementation criteria, shall we include sustainability? Because priorities for funding of the national company, they are set on the annual basis. So if this year the active case finding is a priority, it will be implemented. But if it is not seen as a priority by the ministry this year, then it will be not sustainable at all, unstable. We will show that as an available mechanism, a mechanism in place, but without funding allocated by the state, that's a different situation. And my second question, this indicator covers two components: active case finding. This is what we are doing, and it is covered. So there are actual opportunities, and we expect that in the future, this will be done with the funds of the national insurance company. While speaking about social support, this is a very different area. This is another ministry. And there we have no ideas how it could happen with funding from the national budget, but that's the same indicator. So maybe this indicator needs to be subdivided, case finding and social support, because money may be allocated from different sources at the country level. And then reporting needs to be different as well. The ministries may progress on one of the issues. Our national insurance company is engaged and committed, while for the social component, it is almost zero progress. So maybe we need to break down those indicators. Thank you. Oksana, thank you so much for a very good question. And thank you for having shared the experience of Moldova. This is what we mentioned. Every country may have its own experience and some unique needs regarding the reporting format. Saihat, maybe I would ask you to step in here, because I believe that here it is important to speak about coordination with various sectors. And maybe here, this multi-sectoral coordination and accountability will support data collection from other sectors, because that's a very reasonable question. Not in all countries, the social components will be provided by the National TB Program or by the Ministry of Health. Saihat, are you with us? Yes, I'm with you. Thank you so much, Oksana, for this interesting question. And I go back to those two indicators and I try to understand. Again, going back to the comment that I shared. Oksana, you are now speaking about monitoring at the national level to check, to follow, to track the progress. And you are right saying that psychosocial assistance, because social assistance, this is from the other ministry, but psychological support, this is provided by the Ministry of Health. But there are countries where those ministries are merged and it will be easier for them to collect this data. So I do not quite understand the question addressed to me as a WHO representative. I mentioned that for WHO, it will be very difficult to go into a specific situation of each country and to take that into account and to analyze this indicator at the quality level. But this indicator is important and we need to collect the data. So currently at the global and regional level, we use the quantitative method. At the regional level, we try in our reports to indicate qualitative analysis, and this gradation will be helpful there. But we understand you and we're thinking about this question, but I believe that this is a question that needs to be discussed at the national level. and it needs to be taken into account in the national reports. I agree with Julia that here these processes need to go in parallel. I mean, involvement of the other sector in those countries where social protection and healthcare are separated. Now, what I would like to... Oh, I have another concern, and this is how this data is going to be collected, because you have mentioned that the data will be submitted to the respective ministries, but who's going to send those queries? NTP or CSO? Then which CSO? And in countries there are various platforms, and there should be we are not saying that there should be one platform where there is discussion and then CSO speak this one voice, single voice when they deal with the Ministry of Health. So who's going to undertake that responsibility? I believe we need to discuss that as well, because that will impact the data collection quality. Sorry, Oksana, that I could not answer your question, but Serhat, I believe that you have answered this question in your introductory address, and that's why I pass the floor to you, because here, Oksana, multi-sectoral interaction and accountability mechanism is very important. When we speak about that, one ministry cannot respond to all the needs and all the issues relating to TB response. And if you separate provision of services, as I had mentioned, in some countries, psychosocial support is provided by one ministry, but for you, they are divided. And here, interaction between the two ministries needs to be very close. And here, the mechanism of multi-sectoral interaction and accountability could be helpful for interaction and accountability, because the ministry and the national TB program of the ministry, I just don't know which ministry is responsible for you for provision of the psychological support, they should interact. Actually, the TB program, national TB program, needs to develop a certain mechanism or a document that will oblige the document to coordinate the work and then thus facilitate data collection for the national TB program, when upon request the national TB program will be able to receive data for to provide psychological support. So if there is the mechanism of interaction and reporting, which is determined by the roadmap or something else, thus the ministry that provides psychological support services needs to have the budget, and also they need to have the policies which will oblige them to provide those services. And thus this mechanism that we keep discussing, not many people understand why this is needed, but when those questions arise where one ministry provides one service, another service, there we may get the problem that there is no interaction and there is no comprehensive approach to provision of services. And thus, on our part, I believe we won't be able to subdivide this indicator into separate blocks, but at the country level, where these services are divided between the two ministries, there we need to think about how to develop interaction to collect this reporting. And as you have adequately mentioned, if your ministry or the national TB program succeeds in one block, but lags behind in another one, we need to think about how it will be possible to not even divide, because we refer to, in the indicator, we speak about psychosocial support. So this is just one single thing. And maybe there we'll need to think with the colleagues from WHO monitoring and evaluation, how to divide that. But I believe that it is important to develop collaboration there between the ministries on TB and the respective accountability. You would like to add something? Yes, I see that we are lagging behind, but this discussion is very interesting. And while Yulia, you were speaking, I had another look at our program. There is a presentation on the algorithm and relevance to data collection approach. Maybe we will discuss it there, because this approach to data collection is very important. I agree with you that we need to include the mechanism for multi-sectoral accountability, and that again means that the countries need to implement the mechanism that has been developed by WHO. It needs to be adapted and it needs to be implemented. And there, one of the components is monitoring and reporting, and another component, this is the review. What's done after monitoring and evaluation. This is high-level review. And in this document, it is important to indicate how it is required to approach data collection, the more so if this is not only about the healthcare sector, but also other sectors. So we speak not only about these indicators included into our regional action plan, but we also speak about those indicators which are only indirectly related to TB. So we are going a bit beyond, but these aspects, they are linked, and I'm grateful to Oksana for having raised that issue. So I believe that we need to keep working in that direction and to discuss that, because one thing is if, Yulia, you present the algorithm, and another thing is how the countries are going to implement that and who is going to do that. And because we have high level of expectation from CSOs that they will help us to collect this data at a quality level, the more so that not all of these indicators we previously collected. So we have a lot of hope for CSOs that they will help us to collect quality information, and there we need to discuss it with them, how they're going to do that at the country level. And I would like those countries that are represented today. That's why I asked the question. It depends on you, that you promote, advocate at the country level via your MPs, via your platforms, and so that the country adapted and started implementing this mechanism of multi-sectoral accountability. If we only rely on the public health sector, we will not achieve any ambitious targets for TB, because that's a social disease. So please promote that in your countries, insist on their adapting and implementation and development of the roadmaps where they clearly indicate the role of each sector, the indicators based on which every sector needs to report, and then you will start with these 4 indicators at the country level, and then you can proceed with data collection for other indicators for other sectors. Thank you.
Oksana, once again, thank you very much for your question. As I said, the question is related to multi-sectoral cooperation and accounting, and we will think with our colleagues how it will be possible to reflect your comment, let's say so, and we hope that it will be easier for countries to report. So I heard now about your question how it is being done on the country level. Ira, maybe you will also join us, because we have discussed it. Of course, CSOs independently will not do this exercise themselves. Key coordinator is the NTP, national program. They will give an assignment, because WHO requests data collection to the national TB program, and algorithm specifies in principle who is sending a request, who it is addressing, which CSO should be engaged, and it is related to the fact mentioned by Yana Sergeyevna Terleyeva in her presentation. NTP knows the CSOs, where they work, in which areas. So the country conducts mapping, not only of the organizations that work for the GF grants, but also for the grants from other donors. Everything here depends on the national TB program. There is no clear instructions about which organizations should be addressed, should be contacted, because everything depends on the national context, how it will be reviewed and viewed by the national TB program. But we have the key action algorithm, what should be done on the country level when we have a request from WHO, and who should be involved in the data collection exercise. It is very important, Sahat, what you mentioned and what Yana Terleyeva mentioned. We hope that the civil society organizations, we hope very much, we rely on them. And I talked about it in my entry speech. It is important to allocate specific funding for the new projects which you are going to send your requests about, because this exercise is very thorough, and it is important for you to have sufficient time, personnel, so that you would be able to conduct this exercise and later on to analyze this activity in cooperation with the NTP to be sure that the data submitted by the NTP reflect the real life in your country, real life situation in your country. So it is important for you to have funding and human resource which you are able to allocate for such activity. So I hope that I gave you an answer to your question, maybe in brief. And dear colleagues, if you study this algorithm in detail, you will find a lot of answers to your questions. But if you have any questions in the process of getting acquainted with this document, we are ready to answer you. Dear colleagues, thank you very much. Thank you, dear participants, for timely and correctly raised questions. Thanks to our speakers for answering these questions, for addressing them and providing a detailed explanation. And I would like to remind you that not so much time is left. So I don't see any more raised hands and no more questions. And I give the floor to Irina. Thank you very much. I will give another comment, which is also very important because this question was asked. When we developed this algorithm, so the first question was who would be responsible for data collection and how it will be done. Algorithm describes it in general terms, but we think that in Ukraine, and I'm thankful to our colleagues who underscored the importance of multi-sectoral activity. In Ukraine, the National Council is responsible for this work, and at the same time, this National Council performs the role of CCM for the Global Fund grants. And it was specified in one of the first drafts of this algorithm. Because if all countries have similar mechanism, it would simplify the data collection process. Because on the level of the national CCM, countries CCM, all the data related to the regulatory issues, everything is coordinated and agreed on the level of the National Coordinating Council of in the country. We understand that not all countries have this system, and we simplified this task. But as soon as the NTP is a national state-funded body in most countries, in each country, NTP is a governmental body as a rule, and we understood that sending the request and data collection and use of all these mechanisms of the governmental structure to submit these requests for data collection. Well, it is possible. And Yana Sergeyevna also said that the key role in the country and key user of this intervention is the national TB program. And it is true for all countries, even for those which do not have national coordination councils. National TB programs is the key user of this data. And on this optimistic note, we switch to indicators number 3 and 4. And here we have an important comment. These indicators are related to quantitative data, quantitative indicators. And we suggest to combine the internal and external monitoring approaches. Internal monitoring is routine data collection and analysis done by CSOs using the reporting documentations, and each CSO can use its own system for to monitor the rating. And external monitoring, it is recording of data on CSO engagement in provision of active TB case funding services in healthcare facilities that provide such services. Also, data can be collected in addition to the national TB program by the key recipients of the Global Fund grants or other organizations that provide financial support to CSO projects. Next slide, please. So also, we do not yet shift to indicator 3. An important comment is that the quantitative indicators provide us an opportunity to see the overall impact of CSO-related indicators on TB programs in the country. And it gives us an opportunity to monitor annual progress in reaching the milestones, to monitor and track and compare the indicators of CSO engagement at the country level and apply adjustments on the based on the monitoring results. So indicator number 3, share of people with TB found through active case funding activities implemented through CSOs. What does this indicator measure? It helps us to track the dynamics and the proportion of people with TB referred to TB diagnostics by civil society organizations, and the total number of people with TB in the country and its progress over time. Rationale for this indicator is following. We understand that it is an active activity. So these organizations help people to be enrolled in the diagnostics and treatment of TB and screening for TB. And this indicator is calculated on the following basis. We use numerator and denominator. Numerator is the number of people with TB from key populations referred by community volunteers, NGOs for TB diagnostics and treatment. Denominator will include the total number of people with TB diagnostics during the same reporting period in the country. Next slide, please. And now a few words about the method of measurement, how we collect the data for the numerator. NTP will solicit the information on the number of people from key affected populations from all grant recipients and other organizations that provide financial support about the number of people from key populations who were referred to TB diagnostics and treatment in the reporting period. Data collection for the denominator is done in the following way. NTP collects information about the total number of people with TB within a routine monitoring activity. And next slide, please. And again, we repeat the frequency of measurement. A semi-annual report gives us an opportunity to see the progress and evaluate the progress and react to potential risks. And annual report provides us an information about this indicator for the NTP. Numerators and denominators here, maybe it is complicated at a glance, at a first glance, but when this algorithm is provided to NTP, each country will organize discussions with the specialists in M&E, and I will open you my next slide, and you will see the sample form. And in fact, it is rather simple. You have a link to the form under each of these indicator in the document on algorithm. And if you click on this link, you will see a table, a spreadsheet in Excel. So you don't see it on the screen, dear colleagues. Colleagues who will show us this. So thank you very much. So when you click on this link, you will see that this form is rather simple for use. So this spreadsheet is in the Excel format. It can be done by representatives of a healthcare facility which provides services, or by other organizations that provide financial support to the projects implemented by CSOs, and by the same by CSOs themselves who provide services in relation to TB. This form has only 2 columns, and it is very easy to understand here. You collect and accumulate all information. So all information is accumulated and summarized by NTP. And this is all about indicator number 3. And we have a question. Oksana, please. Thank you very much. So you show it so quickly and it is so beautiful, switch on. I have a question about validation. So we are working in practice in the area of case finding about enrollment in care on the basis of X-ray results. So, and it can take 2 and 3 months from the moment of finding to the moment of enrollment. So until we validate the data, data about the infected person is not included into the database. So it is not so quickly as you say. Maybe it would be more correct to include the indicator about the first visit to the healthcare facility, because it is important. In this case, we will be able to validate the case, because some patients do not come back if they are not offered the treatment, and they can be lost to follow up. We have such a systemic problem, and we are talking about it, but the situation is not improving. So the principle for the validation of indicators should be explained in more detail, I think. Thank you. Oksana, thank you very much for your question. Have I understood you correctly that you mean that you are involved in active case fund and the person is listed as if enrolled in care? Or so we found a person, but before this person starts receiving a treatment, this person is not entered into any database.
Да, Оксана, давайте, у
Оксана,
нас нет немедленного ответа на,
So we do not
на
have
ваш
an immediate
вопрос, но
answer
спасибо
to your
большое, что вы
question,
его
but
подняли,
thank you
потому
very
что
much
это
that
очень
you raised
важный
it, because
элемент,
it is a very
да,
important component
который показывает
which
роль
shows the
гражданского
role
общества,
of
что
civil
ну, потому
society,
что здесь индикатор у
because
нас
here the indicator
как раз и
is
говорит о
about the fact
значимом
that
участии организации гражданского
civil
общества в
society
активном
organization
выявлении. То есть
is
вы как раз
the
подняли вопрос о том,
meaningfully
что вы
involved in the
активно
case
выявляете
finding.
людей, но по
So you say
цифры
that you are actively finding the
национальная
cases,
программа
but
подать не сможет, потому
you,
что
the
он нигде
national
у них не
program
фиксируется.
cannot
И вот
provide
здесь,
figures
скорее
because
всего,
your data is not
как
fixed,
раз
is not
ваша
entered
отчетность,
anywhere.
она
And
должна
in
будет
this case,
как-то
your reports should be somehow
биться с тем, ну, она, скорее всего,
correspond.
не скорее всего, она не будет биться с тем, что
It
будет
will not
подавать NTP,
correspond to the data
но для
provided
этого,
by the
наверное, и
NTP,
нужно вам
but
будет
for
привлекаться к
this
сбору
purpose,
данных,
you
для
need
того,
to
чтобы вы
be
могли дать
officially involved into the
альтернативный
data collection to provide an alternative data report to the United Nations. The
Ну да, наверное, здесь нужно подумать, Оксана.
well, we should think about it. I cannot give you an answer right now, right away. I can give you this answer. I can comment, of course. I cannot give you an immediate answer. We need to think with colleagues, together with colleagues, how to do it better so that your problem would be taken into account. Yulia, it is absolutely correct. Ira, Ira, your connection has disappeared. So excuse me, so I do not hear you well enough, but I would like to say that in principle, it is a very important comment, but I think we need to organize additional consultations with the representatives of monitoring and evaluation, because not everything is so easy and the situation is not the same in different countries. Let's think about it and think about the answer, because right now we cannot give you the answer. So that's why, Oksana, thank you very much. And I have another idea about the proportion of case funding. So if we use different approaches to calculate the percentage of case finding, primary healthcare calculates it in comparison to the people who turned for the health examination, for the health check. And in our program, we used a different method of calculation. And again, we need to specify how to calculate this proportion for each indicator. And so how we calculate the step-by-step indicators. So because we see that different organizations and programs use different approaches to calculate the indicators and percentage. So dear colleagues and Oksana, this is what we were talking about. And in principle, this plan for the regional they can become a principle, a key basis for the advocacy in your countries, because it is a regional approach, and it is clear that all countries have their unique approaches, but the approach to data collection should be more or less unified. If we talk about the civil society organizations, it is the same. We can think on how we can reflect it in the algorithms, and you can apply these algorithms in your country and key indicators as an entry point for advocacy in order to use the data collection and indicators within some unified approach. Oksana, it is what you are talking about. NTP uses their own approaches, you're using your own approaches, and we try to take into account the interests of civil society organizations in our algorithm to simplify the work on the national level. So we can think together on how we can do it together, how to simplify the algorithm. The indicators cannot be changed. Unfortunately, we can make some clarifications in the interpretations of these indicators, and then in the comments we can make such clarifications, because If we have a specific answer to the indicator, then NTP will provide a comment to its answer.
Спасибо большое.
So here we can think, and thank you. Colleagues, thank you. And I believe that we can proceed with indicator 4. Yes, we are lagging behind a little bit, but I hope that it won't take a lot of our time. I believe we should fit in 10 minutes. I will try to go fast. I would also like to comment quickly on that. We assume that when the algorithm enters each of the countries, the first thing that needs to happen is general consultations of all key partners with NTP. Because since we use the experience of Ukraine, all of these aspects were coordinated at the level of NTP above all. That is why, of course, here we will need additional consultations and more than one. This process is just starting, and believe me, it is also starting for Ukraine. So I believe that at the implementation phase, there will be questions in Ukraine as well. So far, this is the frame. This is a frame document that we ask you to consider as a frame.
Что алгоритм
And I would like to clarify that it's important to indicate that the algorithm has been tested not only with Ukraine, but also by pilot countries, that was Kyrgyzstan and Kazakhstan. So at the level of 3 countries, we have tested this algorithm, piloted it, and we could see that it is feasible and viable. So this is not about Ukraine only. Okay, and we proceed with indicator number 4, and this is the following. Proportion of people with TB who started TB treatment and who received any form of treatment adherence support from CSO. And this indicator makes it possible for us to track the proportion of people with TB receiving treatment and CSO services supporting treatment adherence, and the total number of people with TB in the country, and its changes over time. We will skip this slide because you will see that in the algorithm, this is the list of services actually that we refer to when we speak about the data for this indicator. So we will check further on, and we will provide more precise information about the services that include this indicator. Next slide, please. And calculation of this indicator. The numerator is the number of people with TB who started TB treatment and who received any form of treatment adherence support, including psychosocial support. The denominator is going to be the total number of people with TB who started treatment during the same period in the country. And we proceed with the next slide. And this is about data collection for the indicator, for indicator 4. So now the method of measurement. NTP will solicit the information from the healthcare facilities where services are provided by CSOs, and also from other organizations that provide financial support. And this data should cover the number of individuals with TB, absolute number receiving treatment in TB healthcare facilities, and covered by the following CSO services. This is support of treatment observation, managing loss to follow up, and preventing treatment interruption, and mental health and psychological counseling and support. Thus, the total number of individuals receiving the mentioned services from the CSO is indicated for the specific healthcare facility. If an individual receives several services in the same reporting period, then this person is counted once to avoid application of data about people receiving services from CSO. And then denominator data collection, it is the following. On the total number of individuals with TB who initiated their treatment in the same reporting period is performed by the NTP as a routine monitoring activity. So you see that the approaches for indicators 3 and 4 are to a great extent similar. Let's proceed with the next slide.
Следующий слайд, пожалуйста. Абсолютно идентичный
Now,
подход в измерении
again, the same identical approach to measure frequency. We indicate that semi-annual report shows the progress and makes it possible to timely respond to any actual or potential risks, and the annual report, which is consolidated data. Next slide. And now you can see the format of the table that can be used as the reporting form. You have that in the document as well, and this is also an Excel table. It may be used as a reporting form, but it may also, upon consideration of the country, it may be adjusted to a degree, but the most important thing is that we stick this to the 3 key services. You see those columns and the detailed information to be filled in for the 3 columns. And also, as you remember, the form is supposed to be filled in by representatives of the healthcare facilities where the services are provided, while CSOs, patient organizations, affected communities provide this services. It is also quite straightforward. And when we worked on these templates, reporting form templates, we had discussions with the organizations on the reporting forms that they use. That is why here we make it possible to use something that is already available based on Ukrainian experience. And this is what is quite straightforward, understandable, and it doesn't take a lot of time, because filling in this table, I believe it shouldn't be a problem. It is not that burdensome, and it is quite easy to use. And here we wrap up the review of indicator number 4, but we do not stop our work here. Let's switch to the next slide. Colleagues, can you hear me? Yes, we can hear you. While we are waiting for that, somebody raised their hand, but I don't see it now. Yes, this is Nona. You have a question. Sorry, I didn't want to interrupt you, but are we going to discuss questions about the last indicator or not? Yes, of course. Right. It seems to me that there is a certain risk that we support and promote work with less problematic clients. The more so if we consider that one person receives support once, then it is recorded, and if someone needs extensive support in a lot of categories, this person is also recorded just once as one case. But this is one of several key issues that I can expect with this indicator. Nona, we will address that, and thank you for your comment. We will consider that because we have received several comments already that attract our attention to certain details. We will consider, and we will see how we can present that. Thank you. I have a question. I see that Nona raised her hand, and I didn't want to interrupt too, but they say that there are no silly questions, but I have a very practical question. If we go back to data collection, there you say that NTP requests information from the healthcare facility, And then my question is, what's the role of civil society in data collection for this indicator? I mean, where is the role of CSO? If we ask for this information, for this data from healthcare facilities, then how can CSO support quality data collection? Well, it is clear, and I will try to answer this question. So it is assumed that this data are also filled in by CSOs. So at the beginning, we said that we merge these approaches here. And this may be information that is based on the facilities that provide the services, and also CSOs, they fill in this form. So in the form, well, maybe it's not as clear on the screen, but we say that for them, they are the responsibility of the organization that provides the services for filling in these forms, for collecting the data. Sayhat, have we addressed the question? Not quite, because so then this is about parallel data collection, that CSOs collect this data, and it is coordinated with the healthcare facility to verify the data, or what? Because I would like to understand the role of each stakeholder in collecting this data. Yes, we assume that NTP would verify this data in this way, and then in this way we avoid data duplication. Okay, thank you. Colleagues, we have another question from Nona. Is it the previous question? Yes, the previous question. Okay, thank you so much. And then no more questions so far, and we can proceed with the next slide. Yes, one more indicator. No, we have a question now from Oksana, sorry. Thank you. Not so much a question, but I believe Sayhat's question is very important. Who collects the data? Because NTPs may request data from healthcare facilities, and I'm not quite sure about whether that's possible. We have a different approach. At the same time, there is a separate financing for the institutions that have their own indicators. So it's important to decide who collects the data, who's ready to come up with the general overview of various data. There are various recipients and healthcare facilities. There are national budgets. Who's going to consolidate and to come up with the overall picture? Thank you, Oksana. What we mentioned at the beginning, the query for data submission is submitted to the National TB program, and as indicated in the algorithm, NTP is the coordinating authority that collects, analyzes the data, and submits those to WHO. So NTP is going to be the consolidating authority that will see who we request the information from, how we provide it, process it further, and provide it to WHO. So that's my short answer, and that is the National TB program. I see that Sayhat raised her hand, and I'm sorry, that's a very interesting discussion, and I immediately come up with some ideas. It would be good if countries in their case-based databases, if they use this indicator, and then it will make it easier. Where you fill out the database, you will have this indicator in place that the person receives, if the individual receives any support from the CSO or not. So we need to think one step ahead to ensure sustainability. We need to think about how this recommendation could be extended to the countries so that it were possible to facilitate data collection. And colleagues, let me emphasize that the algorithm and the monitoring and evaluation plan, that's a good advocacy instrument that you can use, and all the indicators provided or suggested, it would be good if they were included into the routine monitoring process, if that is possible, via the electronic data collection systems and reporting systems. That will significantly facilitate the work of NTP. But we need to grant on the context and unique specific features of each country, because Oksana, each time you address very important issues that highlight how unique the system or in your country is in particular. Unfortunately, the algorithm won't be able to provide for the unique approach for every country, because it is developed in order to unify data collection, but the country, based on its realities, and as Ira mentioned during when she commented on the slides, well, there you can adjust certain aspects based on realities on the situation in your country, so that this data could be collected. So, and Sayahat also says that she agrees with that it needs to be adjusted.
So colleagues, let's move further. We do not have time, so let's finish it quickly. And if you have additional questions, please write them in the chat, and we will try to give you answers in email. We have emails of each of you, and we will write you the answers to your questions, because we already beyond our time. So I have a very short comment before we switch to the next slide. I'm thankful to Sayahat for the correct question, and we suggested when we were discussing quantitative indicators 3 and 4, we involved M&E specialists, because this comment exists in the algorithm. It is not mentioned in the presentation, but it is included in the document. So it is envisaged that these indicators will be included in the national system of monitoring and evaluation. So this data collection will be systemic, and we need a systemic data collection, and it will help us to see the engagement and to track qualitatively these indicators. So this was my comment. We are very glad to see your questions, and thank you, dear colleagues. And now a few words about additional indicator. We called it additional indicator because in Ukraine we think it is important to keep it, even if it is not included into the M&E system. But we also suggest WHO to review the possibility to keep this additional indicator in each country. And it reads like this: proportion of people with TB who successfully completed TB treatment thanks to the support from CSOs. And it will help us to track the successfully completed TB treatment and impact of social and psychological support on treatment adherence. And also it is important, if the CSO has a target of treatment defaults not exceeding certain percentage, this indicator will enable tracking of the progress towards this indicator in dynamics. And please, next slide. And this will be the last slide, which is related to additional indicator and to the review of the algorithm in general. So the calculation of this indicator is like this. Numerator is the number of people with TB covered by any CSO services who successfully completed their treatment, and denominator will include the number of people with TB covered by any CSO services. Data collection in principle is the same as for the indicators number 3 and 4. For the reporting period, NTP will solicit the data for the reporting period from the healthcare facilities. And I hoped that 10 minutes would be enough for us. And this is our last slide. And this is the end of our review and our discussion. And we will be thankful if in the process, you will come back to it and review the document itself. And if you have any comments or additional suggestions or requests for clarification, we will be glad to discuss it in the working process, because now the next stage for us all is implementation. And until this moment, we need to discuss all the nuances. Thank you very much, dear colleagues. And if you have any more questions, you are welcome. Dear colleagues, as we said, please write your questions in the chat. We see everything you write in the chat, and in the section Q&A, we will address all your questions and we will try to answer all the questions. And I would like to thank once again our speakers, Ira, who put a lot of efforts for this algorithm to be seen by you today, despite all the problems in Ukraine with the rocket attacks and electricity blackouts. Thank you, Sayhat, for the support from the regional WHO office, and thank you, dear colleagues. But this discussion is very important, and I hope that this discussion help you on your country level to meaningfully engage in the data collection. Another important aspect, and I would like to focus once again on what Yana Terleeva said about Ukrainian NTP. National TB programs need your support to qualitatively collect the data related to the involvement, engagement of civil society. This year, we start a pilot project in 3 countries. Unfortunately, we were not able to involve more countries. It is Ukraine, Kyrgyzstan, and Tajikistan. If your countries have the opportunity to be involved, this process is very intense. If you have resources, we are ready to work with you on data collection and in cooperation with your national TB programs. The WHO will send in the beginning of next year the database collection forms, which include all these 4 indicators. And you need to know and understand that these questionnaires will be sent to the countries, and it would be great if you are engaged in the data collection. At least you can ask the NTP how and when they're going to report this data, so that you would be able to make your impact. And maybe if you do not agree to some data, you can also specify it. So that is all I had, maybe 2-4 minutes. Once again, I would like to thank everybody. Thank you that you invited me, and excuse me that I gave so many comments and talked a lot, but the topic is very interesting. But in the end, I would like to emphasize your role in the countries. Please be active. Do not wait until somebody comes to you and involve you in the data collection process. Please be proactive, show your initiative. All countries have country coordination mechanisms, and CSO are represented in the CCMs. And this question is already discussed in the CCMs, that CSOs are ready to be involved in the data collection. It is one of the channels through which you will be able to influence the data collection, monitoring, and other processes. Thank you. So, dear colleagues, thank you very much. Thanks to all participants who managed to join us. Thanks to speakers who presented these questions. Also, I would like to tell you all that we are connected. We have your emails. You have my email. And after our meeting, we share all the materials of this meeting, all the presentations, video recording, and you can send your questions which were not answered today, or maybe the questions that you have after the meeting, and we will be ready to answer your questions. Have a nice day. Thank you very much. And goodbye. Dear colleagues, thank you very much. Please include this activity